afternoon, and I'm Leslie Lewis. I haven't met you before. I'm the aquatics coordinator and the CPR and first aid instructor here on campus. So a lot of you I've met before. So we are going to do a basic review today of some of the changes, the 2015 changes in basic life support and first aid. Remember, at the end you will have a test, and y'all have picked them up, so at the end we'll do that. So are you ready? Okay. No. Turn on for starters. Okay, so number one, first and foremost, is your personal safety. Okay, whether you're at work or at home, your safety is still the highest priority. So as hard as it is, because usually you're going to know the person that you're doing first aid on. So as hard as it is, always pause and assess the scene for safety. If you go running on in, you could make the situation worse, and not only would the paramedics have to be there for the person you initially wanted to assist, but then for yourself. Consider the possibility of hidden dangers. Are there power lines down? Are there electric cords down? Is there electric cord near a puddle of water? Just look around. Okay? If the scene is not safe, you can still call 911 and wait until the scene is safe to approach. Standard precautions. When caring for someone, obviously you can be exposed to blood or infectious materials. You can't tell by looking at somebody if they have Hep B, Hep C, HIV, right? So, regardless of the person's relationship to you, protect yourself. You're going to mentally assume they are infected. Okay, and that's hard to do. It could be your great favorite Uncle Bob. And my husband's, in my case, is one of our closest family friends, and he told us probably 30 years ago that he's HIV. Could you tell it by looking at him? No. And he was very trusting to us to tell us. So, standard precautions. Always assume they're infected. Say, Good Samaritan laws. If you're ever bored some Saturday night, Google Oregon's Good Samaritan law. It's about 34 pages long of legalese. So, every state in the United States passed these because people were afraid to get involved, bystanders, because they didn't want to be sued. So you are covered when you're away from here by a Good Samaritan law, as long as you voluntarily assist. You cannot expect payment or compensation for assisting anybody, okay? That you're reasonable and prudent, that you're not giving care beyond your training. So you can't break open your ballpoint pen you're using and do a tracheotomy. That's beyond your training. And you're not negligent or completely careless in delivering emergency care. Okay? Each Good Samaritan law varies a little bit state to state, but know that you are covered. So 2 weeks ago, 3 of the 4 days I left the village, there was a car wreck where Selmet is, right there on that intersection. 3 of the 4 days, it was shift change. So I went ahead and stopped because I knew I'd be covered by the Good Samaritan laws in case anybody needed my help. So when you're away from work, you are covered, okay? Abandonment. So once care has begun, you cannot abandon them unless somebody of greater level of training has taken over. Now you can leave briefly to go call 911, but you need to report back to the person, okay? Nothing else, think of yourself. Would you want to be left alone if you're hurt and somebody was there and then they left you and never came back? Make you feel kind of lonely. Consent. So if somebody is responsive, so conscious and can talk, you have to introduce yourself and ask them if they can help you. If you can help them, excuse me. So if they say no, you cannot touch them. What you can do is still call 911, right? And a lot of times people are so embarrassed they don't want to draw more attention to themselves. If it is a child, consent, you ask the parent or the legal guardian. If they are not present, you have implied consent. If it is a person with dementia, you need to ask their caregiver or their guardian, okay? And if they're not present, so if there's somebody has wandered off, you have implied consent. If somebody is unable to speak to you or unconscious, you have what is called implied consent, and you can legally help them. Your duty to act. So, your duty to act is a requirement to act towards the other people and the public with attention, caution, and prudence, okay? That any reasonable person would do in the same circumstances. You can be considered negligent if you don't do that, okay? If that makes sense. If you are a state licensed healthcare provider, which most of you are expected to start CPR as a duty to act, unless you have in hand their DNA. I mean, not DNA, DNR, their form or their pulse form, okay? So it's your duty to act as a licensed healthcare provider to start CPR. Okay, assault and battery is a criminal act of placing a person in fear of bodily harm. A conscious and aware adult has the right to refuse medical treatment. Remember, you have to get consent. Forcing them to take care can be grounds for charges of assault and battery, even if you're meaning well. Okay? Everybody understand those? Okay, hold on, I heard. Okay? So the Good Sam, just to review it, you are going to provide assistance without compensation. You're going to be reasonable and prudent. You're not going to provide care beyond your training or be grossly negligent. Does that help some people? Okay. Starting CPR, the legal considerations. So we're going to start for CPR for anyone in cardiac arrest unless obvious signs of death are present, okay, including rigor mortis, dependent lividity, or when conditions are present that are incompatible with life. Do not start CPR if it puts you in danger of injury, okay? Or if the person has a valid pulse. In a mass casualty event, okay, this is new. In a mass casualty event, when there's limited people to do CPR or first aid, such as in like a shooting, a mass shooting or anything, anybody that needs CPR, you bypass. Does that make sense? Because they're already dead. That's why we do CPR. So in a mass casualty event, you are going to help a person with a higher chance of survival. You do not stop CPR once you have started unless a healthcare provider or other professional rescuer with equal or more training than you takes over for you. The person shows signs of life or you are too exhausted to continue. Okay? So, our BLS, Basic Life Support Assessment. First and foremost, always assess your scene, right? Is it safe for you to approach? Not only that, you are going to prioritize care. So how many victims are down? Why do I think they went down? So if the scene is safe, you can go in. If at any time it becomes unsafe, like in a fire, get out. Okay? The second thing you're going to do is check for their responsiveness. For an adult, you're going to tap them on the shoulder. For a child, you're going to tap them on the shoulder, and for an infant, you're going to tap on the foot. You're going to ask them, are you all right? If you know the person's name, use it, okay? If you are alone, you're going to shout for help. If nobody is at all around, you're going to position the person on a face-up firm surface, so the ground, a mattress isn't going to do it. For an infant or a toddler, you could put them on a tabletop, right? And you're going to start checking for their breathing and pulse. Okay, so you're going to do this in less than 10 seconds, okay? You're going to look. If you are unsure, you're going to assume they're not breathing. Remember, agonal breathing gives us no usable oxygen. Does everybody know what agonal breathing is? Okay, I'm going to attempt it, and if I start coughing, I'll take a drink. That would be a possibility what agonal breathing sounds like, okay? You're going to, same time, you are going to check for a pulse. So, for adults, carotid, okay? For an infant, you're going to go for the brachial. Lift the arm, reach underneath. For a child, somebody 1 to 8, you can do the brachial or the femoral artery for a pulse, okay? Now, you've got to make decisions. If you are by yourself, if not already done so, let's hope you're not by yourself, you're going to activate emergency protocol. Know what it is for your department, people. Know what it is at home, okay? Send somebody, if possible, to get an AED. How many AEDs do we have on this campus? We have 4, okay? 1 right outside this room, 1 right inside the north entrance of Lakeside Center, 1 inside the double doors of Quail Run, and 1 on the crash cart in the Mennonite home. Okay? Send somebody for it. Tell them where it's at. Okay? If we're at work. Okay, so you've sent somebody to call for 911. You've sent somebody to get the AED. If they have normal breathing, normal breathing and a pulse, but they're just unconscious, okay? Normal breathing and a pulse, we're going to put them in the recovery position. I'll go over that in just a minute. If they are not breathing, but still have a pulse, they're in respiratory arrest, and you're going to begin rescue breathing. If they have no normal breathing and no pulse, you will start CPR. So, the recovery position. You're going to put the arm closest to you up over their head, alongside their head. Okay? The other arm, you're going to come across their cheek. You're going to grab the opposite leg that's the farthest from you and lift it up at the knees so that the foot is flat. Using their shoulder and their hip in one continuous motion, you're going to roll them towards you. Okay? You're going to watch so their head doesn't hit. Now you're going to use those elbows and legs to stabilize their body to make sure there's no pressure so they can continue breathing. Okay? We are using this position to keep the airway open. Fluids will drain out of their mouth, and we're keeping the airway open. This is a safe position to leave them in if you have to go for help, okay? If you roll somebody, they're breathing and have a pulse, obviously, because they're breathing, and they're in the recovery position but unconscious, and you can stay with them, watch them closely, and keep monitoring them, because at any time, their heart could just get exhausted and quit breathing. Okay? When somebody is in respiratory arrest, that means they have a pulse but are not breathing. Respiratory arrest. So we've assessed the scene, we've tapped their shoulder, there is no response. We're getting somebody to call 911 and grabbing an AED. For at least 5 seconds, but no more than 10, we're going to check for their airway. Okay, we have decided that they are not breathing, but they still have a pulse. We're going to do the head lift, chin tilt position to open their airway. Use the jaw thrust if you suspect a spinal cord injury instead. You're going to do 1 breath every 5 to 6 seconds for an adult, 1 breath every 3 to 5 seconds for an infant or child. Remember, we're only making the chest visibly rise and no more because we don't want air into the stomach. After 2 minutes, you're going to reassess the person to see if they still have a pulse and do it for no more than 10 seconds. If they still have a pulse, you are going to continue to give rescue breaths until somebody of equal or greater training takes over or they show signs of life. So I went over this just now. So with infants, it's the same protocol, but we're giving 1 breath every 3, and children every 3 to 5 seconds, a little bit faster. Okay, am I going too fast? Okay. Okay. I want to emphasize that we want everybody here in the village to use a CPR mask. They are in every first aid kit and around campus with AEDs. If you don't have one, if you look on Amazon or Walmart.com, they're only about $5 or $6. And from experience, I have found over the years it's a lot easier giving rescue breaths and doing CPR if you have, not besides protecting yourself, it's a lot easier to do to get a good seal. First thing you're going to do that it doesn't say, or it does say it, is inspect your mask. Is the one-way valve in place? Okay. Put it over the bridge of their nose. Secure it with the thumb and index finger. Do the head tilt, chin lift. And you want to make sure that you're not pushing their mouth back shut. So you're lifting the face up into the mask, and they really do get a good seal pretty easy. And you're going to blow through that one-way valve until you raise for about 1 second. Get a visible rise to the chest. Take your mouth off the mouthpiece. Let that person exhale and give them another breath. We're always going to do 2 breaths. Children and infants, remember, their lungs are the size of their fists, so only give them as much air that would be feasible, okay? Sudden cardiac arrest. This is the drastic one that whenever anybody watches a CPR video for the first time, they think it's poor acting because the person's standing and just falls over. That is not poor acting. That is how fast a sudden cardiac arrest can occur. Okay, so when the heart is normally just beating nice and it becomes all disorganized and quivers, that is the start of sudden cardiac arrest. That's ventricular fibrillation. Okay? The victims collapse and they stop breathing. CPR is your immediate treatment for sudden cardiac arrest. Okay? The CPR can restore enough limited oxygen to keep the brain and vital organs operating along with the chest compressions for a short while. Whoever marketed compression-only CPR did an incredibly wonderful job of marketing it, but the body needs fresh oxygen to survive. So when you're doing compression-only CPR, all you're doing is moving the what little oxygen they had in their body around. So they need fresh oxygen. Early defibrillation. the most effective way to stop fibrillation is with a defibrillator, with an AED. The faster you can get the pads attached, let it do the monitoring, and if a shock is needed, the quicker you can do all that, the better chance the person has for survival. Okay? When a person is in cardiac arrest. Okay, remember, we're going to assess the person, and I'm going to talk to I'm going to give all three at the same time here. For adults, infants, adults and children, tap the shoulder. Are you okay? Use their name. An infant, tap the foot. Use their name. You're going to check for normal breathing and pulse. If the pulse is absent, breathing's absent, activate EMS, call 911, have somebody get an AED, and start CPR. We always start CPR with chest compressions. We're going to do 30 on an infant, 30 on a child, 30 on an adult. Okay? One hand on top of the other above the xiphoid process in the center of the chest. You're going to go at least 2 inches deep for an adult, 2 inches for a child, 1.5 inches for an infant. You're going to go for everybody pretty fast, 100 to 120 beats a minute. That's 1 and 2 and 3 and 4 and 5. Okay? We're going to move it right along. You push down, let the chest recoil, keep the hands on the chest. Make sure you're nice and perpendicular, okay? Be prepared. I don't want to sugarcoat it, you guys, and if you haven't ever given CPR, be prepared. It sounds terrible. The person looks terrible. They might be foaming. They'll be gray. There could be feces. There could be urine. It's not a pretty sight. But why are we doing CPR? They're dead. There's going to be noise because anybody over 7 years of age is already developing scar tissue on their sternum. 7 years old. That makes a noise when it breaks. Okay? You might break a rib. You might not. Some people are sure they've broke 1 million ribs and all they've done is broke loose scar tissue. So the way I've looked at it, and for myself, is we did this. How come it's not going forward? There we go. If I'm prepared for the smells and the sounds, then I can stay calmer doing it. Okay. To providers CPR. So this is an option for those of you who have BLS level. If you have a community level CPR card, this is not an option for you. It's very important to have good coordination and talking and communicating when you're doing two-person CPR. In two-person CPR, one person is going to be the compressor and give the chest compressions, while the other person does the rescue breaths. Avoid being on the same side of the body, right? I find it easiest if the person giving the rescue breaths is at the head and comes over forward, and if not, then you can do one on each side. Okay? Compressions are exhausting, but you don't want to switch too soon because you want to get a good rhythm. 2 minutes is like the minimum amount, because after 2 minutes, you usually start giving shallower compressions and not quite as good. So when you're the person giving the compressions, you're going to be counting 28, 29, 30, and then the other person's going to go, you're going to say breathe, breathe. You're going to start right back up, right? So when you're getting tired, when you've done quite a few rounds, then you're going to say, after the next set of compressions, I'll do the rescue breath, switch. So then you will get up and move. The compressor will move toward the person's head doing the rescue breaths and become the new ventilator. The ventilator becomes the new compressor and moves to the other side. Okay? If you have a third person Oh, now it's getting good. They're going to rotate in for the compressor, okay, instead of the ventilator. If you have more than that, have somebody out flagging people down. Using an AED on the adult. So, once somebody has brought you the AED, the best thing is you know the person is in cardiac arrest. Get their clothes off before the AED ever gets there. That way the person bringing you the AED can attach the pads. Once the pads are attached, then let the AED analyze. Remember, you cannot touch the person when the AED is analyzing, or it's going to possibly pick up your heart rate. Okay? If the AED says shock advised, charging, then it will tell you, usually they tell you to make sure everybody's clear, and when press the orange button now. So make sure nobody has any contact with that person, deliver the shock. Once that shock is delivered, resume CPR immediately with the chest compressions. Okay, it's safe to touch them. Once that shock is delivered and they've jerked, it's safe to touch them again, okay? You can use an adult AED on a child, even if you don't have the children or infant pads. Okay, you'll place one pad on the front of their body, one pad on the center of the back, between the shoulder blades. It is best if you have the children's pads, but if not, you can use the adult pads. Okay? And you follow the same procedure. I'm watching my time. Okay, we have some unique CPR considerations here. So, fluids in the airway, if you're going to be giving CPR, so if somebody's thrown up, vomited, or whatever, you need to get the fluids out of the airway first. So roll them to the side, clear their mouth, roll them back onto the hard, firm surface, and begin. Pregnancy. After 20 weeks of pregnancy, the uterus is putting too much pressure there, so you actually have to displace the uterus with your hands to do CPR properly. Hypothermia. Everything's been slowed way down. Sometimes an AED won't even work. If the AED does not work after the first try, then you're going to concentrate on rewarming the person before you use the AED again. Electric shock. Until you are sure that the electricity has been cut to what shocked them, do not get within 8 feet of the person, okay? Once it is clear, their heart no doubt has stopped, you will start CPR. If they've been struck by lightning, those are the hardest people to resuscitate. So don't feel bad, okay? Drowning. So this is a little bit different here. If you are qualified as a lifeguard or have a lifeguard, you will see them. If they're still in the water, that's when we start rescue breathing, okay? So if it's a drowning person and you can get them out of the water safely, or if it's your lifeguard, you start with the rescue breathing, and then you're going to do chest compressions. Be prepared. Most drowning or victims or people that almost drown are going to vomit all over you. If they have had a cardiac arrest because of another injury, then they become a low priority to you. Does that make sense? Their heart has stopped because their leg's amputated, then they're going to be a low priority. Okay? Choking. For adults and children, they're a little bit different. We need to check to see if it's a minor blockage or a severe blockage. So ask the person, are you choking? Can I help you? Okay. When you're asking them, you're seeing if they can still talk, if there's getting air exchanged, or if they've already lost the air exchange. If they need help, if there's no air going in and out, if they can't, you're going to stand behind the person, kneel if it's a child, reach around, locate their belly button, make a fist with the other hand in front of the fist, pull up and hard against the abdomen. Your first try at this is going to be your best chance, because guess what? It hurts. We're scared, we're choking. They just did something to me that hurts. I'm going to tense up even more. Doesn't mean you won't be successful, but give it your best shot your first time, okay? And continue. If somebody's in a wheelchair, you can reach around that wheelchair and go in and up, okay? If they become unconscious, lower them to the ground. You are going to start CPR with chest compressions. But before you would do the rescue breathing, after you do the head tilt, chin lift, look in the mouth and see if you can see anything. You're not going to get air in unless you've dislodged it, okay? We no longer do blind finger sweeps. What they found is most people were actually missing it and shoving the item they were choking on farther down their throat. So we no longer do blind finger sweeps. We only reach in if we can see something. Infants are a little bit different, a little bit harder. So you're going to cradle, and it's best if you sit in a chair, but you're going to cradle that infant holding their jaw, face down, face lower than their body. Do 5 hard back blows between their shoulder blades. Then grab the back of their head, roll them over, being careful not to lift the head again, keeping it low, and do 5 chest thrusts, okay? And you just rotate back and forth. Just be really, really careful you don't lift that head up. And trust me, if you get it dislodged, that infant's gonna let you know, okay? If they lose consciousness, the same thing, start CPR with chest compressions. Okay, we have 2 primary assessments, a responsive person and an unresponsive. We've already talked about the unresponsive, right? We're seeing if they need CPR or rescue breaths, or if they're just unconscious. A responsive person's talking to us, so we're still going to assess the scene. We're going to ask them, now that they are responsive, we have to get their consent. So you don't have to be full-blown, hi, I'm Leslie Lewis, I work here, I'm CPR first aid certified, can I help you? If you know the person, you can just say, hey, Janie, it's me, Leslie, can I help you? Or Janie, I'm here, it's Leslie, can I help? Okay, and they would let you know. When you are doing this, you're going to check for their level of responsiveness. We all know when somebody's not tracking, right? We all know when our friends, even if they say they're feeling fine, they're not. We can tell. First thing you're going to look for after you check their level of responsiveness and have consent is, are they bleeding really bad? Okay? If they've got heavy bleeding, that's what you're going to control immediately. The next thing you're going to look for is their tissue color. Their tissue color and their body temperature. Are they feverish? Are they freezing cold? Are they in shock? Okay? So you're going to check all this, and you're going to call the 911 if you feel it's necessary. You're going to provide the indicated care. Now, a great thing, I always say, when in doubt, call 911. Albany, I'm very proud of the fact for them, they only have a 17% transfer rate. That is incredibly low. So if you're ever with an Albany paramedic and they say, I think you better go, let us take you in, or your spouse or something else, you let them, okay? Because it's pretty serious then. Bleeding. Okay, so direct pressure. You're going to be protecting yourself. You're going to be taking standard precautions. You're going to be using rubber gloves. You're going to use a clean pad, apply direct pressure on the Point of bleeding, use a gloved hand if a pad's not available. And if you don't even have gloves, you could use something like a baggie, right? You're protecting yourself, okay? Once the bleeding is controlled, you're still gonna maintain pressure. If you have a pressure bandage, wrap that around the pad and hold it in place, then you're freed up. Don't pull those pressure bandages so tight that when you let go, they're gonna cut off circulation because the pressure bandages, as you let go, contract, okay? So if bleeding is on a limb and you cannot get it controlled, there are commercial tourniquets available. Just remember the area below the tourniquet usually needs to be amputated. Hemostatic dressings are now also on the market. They've been used by the military for years. Those would be used like for bleeding in a torso when you can't use a tourniquet and a direct pressure is not working. Manual spinal motion restriction. Again, make sure it's safe. Could somebody break their back if they missed a chair here? When they went to sit down and they missed the chair? Yeah. Most definitely. So know your audience, okay? If somebody had osteoporosis really bad, they could break their back. What you want to do is when you are suspecting a spinal injury, ask permission, get consent, tell that person not to move, and you are going to stabilize the head. The big thing for you is get in a comfortable position. If they're on the ground and there's room, lay out so that you're at their head. You're going to put your hands on both sides of their head, pushing in to hold it still, and you're definitely going to try to leave the ears exposed so they can hear. If you're in a car wreck, you could get if it's the driver, you could get in the back seat if the car was safe to get into. Use the armrests of the car to stabilize that head. You want to stabilize the head in the position it is found. So if it's crooked, stabilize it in a crooked position. You still need to protect their airway. So if fluids are building up in their airway, you need to leave to call 911, you're going to put them into that recovery position before you go. Stroke. The exciting new news is 70% of the people that suffer with stroke now are surviving. That's up significantly from 5 years ago. Okay, there is 2 types of strokes. And I'm not going to get into the details. What I want to get into is signs of a stroke, the fast assessment, and things that are really important. So if all of a sudden one side of your body is numb, weak, you're really confused, or somebody has a really dazed look, like they don't know what's going on, they can't speak, or they're slurring their words, which is me after 9 o'clock at night, because I'm not a night person. If their balance is gone, if they can't see out of one eye, severe, severe headaches, those could be signs of a stroke, okay? So what you're looking for is the FAST assessment. This is one good thing that's been marketed very well. If your face droops, ask them to smile. If only one side goes up, get concerned. Arm drift, ask them to lift their arms. If one's going higher than the other, and it's the same side of that face that's not drooping, smiling, there's another sign. Speech difficulty, have them say a simple sentence, okay? Even if it's just, can you repeat after me? See if they can say it. Okay, if they're having issues with those, now's the time. T is double fold. Time to call 911 and time to look at that clock. The medications the paramedics are going to be preparing, the dosage required and they will use depends on the last time you saw that person normal. So it's really important to get a good look at the clock. Okay? Heart attacks. Please do not try to transport the person yourself to the hospital. Call 911 immediately. even if they don't want you to. I think you probably have all have heard people will deny they're having a heart attack till they die. Ladies, your symptoms aren't common. Usually you're going to think you have the flu, with the exception of one thing, no fever. Symptoms can present themselves as chest pain, backaches, or the flu. So if you're with somebody or you're going to call 911 as soon as possible, have them get an AED. Have that person sit in the most comfortable position for them. Loosen tight clothing. Get the waistband unbuttoned. Get the collar down, okay? Biggie, calm and comfort. Reassure the person. It's doing that person no good if you're freaking out and carrying on, okay? Calm. If they are not allergic and have no recent evidence of a stroke, you can give them aspirin, okay? Also, if it's they've had a heart attack in the past or a heart condition, they might be carrying nitroglycerin with them. And ask them if they do have it, you can go get it and they can administer it. You are not a doctor. So outside of here, if some of you are med aids, you can administer things. Okay, this is general public. You cannot administer epinephrine unless you're epinephrine certified. You cannot give nitroglycerin and you cannot administer insulin if you're out on the street, okay? Whoa, are we already to the end? Okay, so after you've been involved in a scary situation, an emergency, common reactions include anxiety. You might find yourself trembling or shaking, sweating, nauseous, breathing really fast, pounding heartbeat. I can keep going. Trouble sleeping at night, replaying the incident over and over in your mind, doubting yourself. All that's normal, okay? All that is normal. I'm not too proud to tell you guys after every incident, and I've been in more than my share, you will find me throwing up. I'll look calm until the ambulance leaves, and then I'm throwing up. Get back to a normal routine. Work out. Go for a walk. Go for a swim. Go for a run. Remember HIPAA. You can't talk to people about this. You can talk to your supervisor, the chaplains here, or HR if it happens here. Okay, remember HIPAA, you're bound by HIPAA. Okay, do I have any questions? Have I totally confused you or spoke too fast? Nobody fell asleep, so that's a good idea thing. Okay. So if there's no questions, fill out your tests and, yeah.